That would be great. Thank you, Clover. Okay, so again, welcome to those of you that are new. My name is Shamia or Mia. I am the Director of Viral Hepatitis Prevention and Clinical Services with the Tennessee Department of Health. And so we'll go ahead and go to the next slide and talk about today's agenda. So we will start with some introductions and just kind of general announcements, and then the didactic presentation today is on TennCare prior authorizations and patient assistance programs, and Dr. Allen will be presenting for us. We do have an adult case presentation as well, and then of course we will have some space for questions and answers, and then some quick closing remarks. So first, some in-chat introductions and some brief announcements while we do that too. So before we get started, I would like everyone to take a second to introduce themselves in the chat. Please make sure to include your name, your role, organization, and whether or not this is your first echo session.
Can you hear me?
Yes.
Okay. Christine Fouch, Nashville Metro Public Health Department, Hep C Navigator.
Thanks, Christine. And feel free, like I said, to introduce yourself in the chat as well, everyone. For those that are new to kind of this registration process, it's kind of new for all of us. Don't forget to sign up through the Southeast Age Education and Training Center. So you can click on the link or the QR code, use the QR code. And I think that it will be, there it is. Clover dropped it in the chat for us as well. And Clover or Dr. Chastain, if you're on the call, anything else to add about registration?
Yeah, I'll just tap in real quick because unless I'm missing Dr. Chastain, I'll just go ahead and discuss it real quick. Very straightforward. Just log on to our dashboard. If you haven't done it before, it'll ask you to do a typical sort of demographics profile. And then from that point forward, you can just continue registering for these events as they come out. This is required if you want continuing education credits. This will be how I know to send you the evaluation after this training. So that is moving forward how credit will be tracked with this registration and the evaluation after the training. And reach out to me if you have any questions.
Thank you, Clover. So next slide. Feel free to turn on your video. We'd love to see everybody's faces. Do mute yourself though unless speaking, and feel free to come off mute and ask questions and such. And again, there'll be plenty of opportunities to do that, but we're always happy to take them as we go too. And I'm not seeing any phone numbers, anyone that joined by phone, so I think we're good. Next slide. A couple of people, it looks like joined under like a username. So hopefully we will get your information here in the chat, but feel free to direct message Anastasia as well, and or update your username so we can see who you are. All right, and just some quick reminders, please never discuss PHI and make sure to treat everyone with respect. And then with that, I think we'll turn it over to Dr. Allen for today's didactic presentation. And Dr. Allen, just say next slide when you are ready and we can go from there.
Okay, can everybody hear me? I'm on a headset.
Yes.
Okay, all right, sounds good. I'm in a different office now. We've moved, so I'm in a office with more people. So I'm going to try to accommodate them and not just have my speaker on loud. All right, so yeah, today we will kind of go through hepatitis C prioritization, specifically with Medicare with Tennessee, and we'll also talk about patient assistance programs, how to navigate the applications and how to get them submitted and approved successfully. Next slide. Do not have any conflicts of interest to disclose with this lecture. Next slide. So for our objectives today, we want to make sure we're defining payer sources, knowing which prioritization department we're applying to. We want to make sure we understand all components of the prioritization process. There are many components, some demographics, some clinical criteria, and some other things that might be asked on the questionnaires. We also want to make sure we're looking at how to navigate and locate applications for patient assistance correctly and how to submit all those documents appropriately, full and thoroughly to the proper organization. Next slide. Here's my list of abbreviations. Several of them will be kind of repeats from previous lectures, but we want to make sure that we're always giving a kind of a guideline of when I use abbreviations. The main one that's new is PMAP. I consider, some people will say PAP. I use PMAP for Patient Medication Assistance Program, just to kind of further specify for it specifically for medication. Next slide. And then we'll go on. And then Mia, do you want to kind of talk about the specific postpartum coverage, or you may go through it?
Either way.
Okay,
I'm happy
I'll let you go for it.
It sounds great. So I believe it was this year, relatively recently, that postpartum coverage for individuals was expanded. So it's a full 12 months that individuals are able to access TennCare or Medicaid coverage. And so this is great for lots of reasons. Of course, it gives opportunity for those individuals that just recently had a child, or actually, regardless of whether or not they make it to full term, to seek medical services. And so within that 12 months, it's also a great space to go ahead and provide hepatitis C treatment. In addition to that, a lot of individuals will ask about dental services, and just a kind of a quick plug for the fact that TennCare or Medicaid also includes dental services within Tennessee. There's lots of different options. The links there at the bottom kind of highlight what those are, and I can drop them in the chat really fast as well. But great opportunity to engage with clients and make sure that they're aware of it. They do have to go online or connect with the I believe it's called Tennessee Connect, to let them know that they are pregnant or were pregnant so that they can access this coverage. So it's the same kind of application process as it normally would be, but they have to go ahead and make sure that they're aware of the pregnancy. So any questions about that before we turn it to Dr. Allen?
I was just going to say that's great information. I know when I first started this job, treating patients who were just previously pregnant, just had their baby, we were never really sure how long their care went for. So that was always kind of a task of figuring out when, if and when their Tennessee Medicaid was going to expire, if we needed to maybe fill out applications for patient assistance as well. That was always kind of something that we were worried about. So that's good to know this information. That's good for a full 12 months at postpartum. We can go to the next slide. So we'll first start talking a little bit about prioritizations, mainly in general, and then more specifically with TennCare in the next couple of slides. So there are different payer sources. That's the main thing, is to figure out what type of assistance or insurance, excuse me, that the patient has. We want to make sure, do they have Medicaid? Do they have Medicare? Do they have both? We want to know which one's primary. If they have both Medicaid and Medicare, Medicare will be the primary. If they have a commercial plan, make sure you collect that card information, because you're going to need to know where to go to do the prioritization. As I've got in on the bottom bullet point, most prioritizations for most insurance companies can go through Cover My Meds. That's a main portal. There are some specific insurance plans that have their own private portals, and there's also some insurance plans like Medicaid plan, excuse me, that require you to do paper forms, and usually those can be located online, and you print them off, fill them out, and then fax them in. You can try to, or we'll talk about that on the next point. Then, if they don't have insurance, we want to make sure we clarify that. If they've got benefits or denials, that's great to also supply with the documentation for patient assistance. So first step, when you've got a patient ready for hepatitis C treatment, is you need to know where we're going to get the medication approved, through insurance or a patient assistance application. Next slide. Here's the main 3 state Medicaid programs that I'm involved with. So we've got TennCare, Mississippi, and Arkansas, and then I've got their links to where you go for their paper forms. I've tried to, I always try to go at least once or twice a year, making sure if Cover My Meds will allow you to submit prioritizations. And I usually get to the same point where they prefer you to fill out their paper form that's online, and fax that in. So you can do some of it on Cover My Meds, but they're probably going to require you to do the paper form as well. So I want to make sure I had the links here on where to go to get those paper forms for those specific Medicaid plans. Next slide. And then here's kind of an overall map of Medicaid access. Excuse me, I'm going to continue to mess that up. Medicaid access throughout the country. Tennessee's kind of in the middle of the row. You can see that we've got green meaning good, and then red meaning not so good or limited access. Tennessee's in the middle. We still require authorizations, but the restrictions have been limited or reduced, and we'll go through that about what has been removed over the years. Next slide. So here's kind of a example of a TennCare PA form. It's going to look like this. There's going to be 3 different forms, so each drug is going to have its own form. So that's kind of the main thing, is making sure you've got your right form, knowing which drug you're requesting, and you'll see when you get down into it, there will be a specific language about a specific drug. So we've got 3 different ones, and like I said before, you can try to submit it on Cover My Meds. When you get to the bottom of it, it's actually going to say, hey, now I want you to print out the paper copy and fax that in, please. So definitely it's okay to do on Cover My Meds, just to have a kind of I guess, an information log of it that you did submit it, but probably going to have to do the paper copy as well. So that's kind of the main thing to know about Tennessee Medicaid program. Next slide. So I wanted to make sure I blow up and kind of go through the different segments. This is going to be just the demographic section. The main thing is going to be patient, ID number, date of birth, all those things. And on the right side, make sure you want to put your provider's name. You don't have to put the DEA number on this. It's not a controlled substance, so you don't have to submit their DEA number on anything that's not for a controlled substance. That's the main thing to know about this little section. And you got 2 little questions at the bottom. Is the prescriber a TennCare provider with a Medicaid ID? That's probably going to be most likely yes. And then that's only if they're probably from an outside state. Would you put yes to the second one? If they're just a single patient contract, maybe from a different state. So usually I'm putting yes if they're state Medicaid provider, and then no to the second one because they're not a single patient contract holder. Next slide. And now we got more of the clinical questions with clinical criteria to make sure we know how we're filling out the medication. If we're, on this one, I just picked Maverick to be consistent. So you would pick Maverick on the left side. The pellets would be for a pediatric patient, so that would be non-preferred. And then we need to explain if there's a pediatric patient that's of their weight, you want to put that as well. They've got their genotype. You'll pick 1 through 6 on their genotype. And then notice at the bottom of question 1, after other, it actually says requested duration of therapy. I wish that was its own question, because I feel like some people can miss that one because you think it's just part of the other. So that's kind of a main key point of this particular slide, is the requested duration is still on question 1 of how long you're going to treat for. Most likely for Maverick, it's going to be for 8 weeks. The next pieces of questions are going to be specific to if they're going to be eligible for the simplified hepatitis C treatment algorithm or not. They're going to ask if they have compensated cirrhosis. So that would distinguish if they're going to be in the cirrhosis or the non-cirrhosis simplified guidelines. And the next set of questions, if they have yes to any of these, then that would kind of rule them out for being eligible for the simplified treatment guidelines. So if they have decompensated cirrhosis, history of HIV, hepatitis B, or previous treatment history, then those would deem the patient not to be eligible for the simplified guidelines, and they would probably most likely need to be referred to a specialist at that point, which is going to be on the next slide. It'll ask who is going to be their specialist if you say yes to any of those questions. Next slide. So like I said, question number 4, if you answered yes to any of those questions, you're going to need to specify who the specialist is seeing this patient, make sure we're adequately servicing this patient well. If you've answered any of those, we deem them to be required to go to a specialist. The next question can be a little tricky because it says, is a patient positive for hepatitis B via confirmatory test? That means, do they have a viral load positive? So I want to make sure we distinguish between hepatitis C or hepatitis B antibodies, whether it be core, surface, or antigen, and the viral load. So we want to make sure we distinguish in that. If you do have a viral load, that is the confirmatory test, or antigen positive, that would be yes. Probably want to refer the patient to a specialist at that point if the patient was positive via confirmatory test. And then the next session would be more for Dr. Alfaro Cruz for patients that are going to be requesting the Maverick pellets. That'll be for the pediatric patients. That'll be a section for the pediatric patients. I have not had any experience having to fill that out. I've yet to kind of personally treat a hepatitis C pediatric patient. Next question is about treatment naive or treatment experienced. And then After that, it kind of talks about if there's other information you want to provide, if they're treatment experienced. At the very bottom of it, if there's any other notes you want to provide. The main things I like to specify in the note section is if there's any drug interactions that I'm aware of. There used to be a section on the PA for that. That's been removed. I want to make sure I clarify that there's no drug interactions with the medication that I'm asking for approval for, and I want to make sure I identify their hepatitis B status. So even though it says hepatitis B positive for a confirmatory test, I still want to tell them if they've got vaccinated or they're indicated for vaccination or they're immune due to natural infection. We will talk more about hepatitis B in a future session. So if you have questions about hepatitis B, you might want to we can answer it now. We might want to just save it for the next session on hepatitis B coming up soon. Next slide. So here's kind of a overview of what I've experienced as far as how TennCare has improved and limited restrictions with their PA form. It's been great. It used to be more on the side of limiting access to hepatitis C treatment, and now there is more access because they've removed all these things. There used to be fibrosis criteria where if they had to be F2 or above on the fibrosis scale to be eligible. There used to be substance abuse history criteria. There used to be renal dysfunction criteria. I played a hand in getting that one removed by showing the guidelines that those restrictions were removed, and so I helped out with that one. That was a great something to be removed because it was limiting me to only using Maverick for anybody who had renal dysfunction. Glucapavir, preventavir, trade name Maverick, excuse me. They also there used to be language about pregnancy and postpartum that has been removed. And then they also added the option of pediatric doses on the form, which is great because there was a kind of a confusion on how to fill it out because there wasn't an option to distinguish whether you're asking for a pediatric patient or an adult patient. So they've added those things, which have been great. I have no issues with TennCare prioritization so far in the past couple of years. So it's been great that they've removed these restrictions and kind of allowed more treatment eligible patients to be treated here in Tennessee. Next slide. So I want to go ahead and take an echo pause here. That's kind of it in a nutshell for prioritizations for TennCare. You definitely want to make sure you're faxing it, the paper form to the right, the number. It's on the form. Just make sure you're faxing the right place. If you don't hear back, just follow up with them to see if it's been approved or denied if you don't get a fax response yourself. This is another photo from Canada as part of my trip in the past month. This is Moraine Lake. It's one of the more iconic photos that you'll see on Instagram and things. So this is my own photo, no filters, no nothing. It was gorgeous, so highly recommended. We can go to the next slide. So now let's talk about patient assistance. So this will be a person who doesn't have insurance and they still need to be treated. We have great, the companies have done a great job of having great access with limited restrictions as far as getting the medication approved. Next slide. There's two different drug companies. So Ledipasvir, Sofosbuvir, trade name Harboni, and Sofosbuvir, Velpatasvir, trade name Epclusa, are both under the same drug company, Gilead. And I've supplied their link to how to get to their application for their patient assistance form. And then AbbVie also has Glucapavir, Preventavir, trade name Maverick, and I've supplied a link to how you get to their form as well. So they do have their own forms, but if you're on Gilead's, you'll just pick your option of which drug it is. And then for AbbVie, they'll just have Maverick. Next slide. So there's a couple components to make sure we're assessing when we talk about a patient assistance application. We want to make sure first we have the application. They're going to also need to show some type of income documentation to show to the drug company that they are going to be financially eligible, aka under their criteria threshold for financial need for the medication, but they're not able to afford it on their own and they don't have an insurance plan. So those are things to ask for: a W-2 form, a 1040 form. If they have pay stubs, it's preferred to bring, I guess, a month's worth of pay stubs, or if they get paid every 2 weeks, bring 2 of them. If they get paid every week, bring 4 of them. So they try to extrapolate either for a month or you can extrapolate for a year, depending on the form, but it'll be listed out on the form. That's kind of the main thing to provide. They're going to ask about household size. They're going to ask where they live. They want to know those things as well. If we get to the point where we'll talk about in a minute about when to write a letter, I write letters for everybody, but we'll talk about when to write letters. And I also have an option for showing insurance eligibility. Now, I have an access to reach out to TennCare to see if a patient's eligible, and that helps as well to show that we have reached out to see if the patient is eligible for an insurance plan and they're not eligible. You can also refer patients to the Affordable Care Act plan to see if they are eligible and want to sign up for one of those plans. Those are things that you can talk with a patient on a case-by-case basis, depending on their interest in wanting to get signed up for insurance plan now, or they're kind of on the fence and not really sure that that's the right choice for them. I usually just go ahead and start the patient assistance application right then. And then if they get insurance, I will switch gears and do the prioritization once the insurance becomes active. I'm more in the mindset to just go ahead and treat them, just because I know that they won't potentially be with me for very long, and I want to make sure I stay engaged with them and they feel like I'm in their corner to help them, because I want to treat them. I know all the avenues. I just want to let them know that. Next slide. So here's kind of to let you know that you're in the right spot for Gilead. Gilead has 2 different ways you can navigate it. You can print out the form. There's an application you can print out online, which is the PDF at the bottom. You can also go through the iAssist portal, which is what I use. It's a portal that it kind of houses all the patients that for Gilead. That way I can submit it electronically. I can upload any documents I might need, whether it be the income documentation or any letters or any insurance eligibilities. I can scan all those in and upload those into the portal, and then Gilead will respond from that via fax. So I have all of my patients kind of uploaded into a portal. It makes it easier to kind of keep everything organized. But if you prefer the paper way, you can still print it out and fill it out and fax it in that way as well. So both options for both companies. Next slide. So here's kind of it's a green form. That's the main thing. There is a red and black form. That's an advanced accessing for Gilead. That would be for PrEP. So I want to make sure, just to cue your eyes to, if it's green, that's for hepatitis C. There's a different form that's for advanced access. That would not be for the hepatitis C. So I want to make sure I distinguish that. So I definitely want to show a picture of the application form. These are just demographic questions. The main thing you'll be selecting for a patient assistance form, it'll be patient assistance program eligibility screening. You'll fill out demographics, you'll fill out the drug, and then it'll ask a couple questions about income on the next slide. So it'll ask about insurance, of course, and it'll ask about insurance information that are applied. So definitely ask those questions to the patient in the clinic setting when you first see them. That way you have answers to these questions. And then down there at the bottom, it kind of shows what they're looking for as far as income documentation. So it'll be a tax return, W-2 form, or last 2 pay stubs. And that's usually preferably if it's bi-weekly pay period. If it's weekly pay periods, get 4 of them just to be on the safe side. And then it asks for annual income. It asks number of members in the household. If there's more than one patient or more than one person in the household that has income, they're going to want that information too. So that's kind of a side note that you'll find if you have more than one adult in the household that has income, they're going to ask for that too. So just be prepared to maybe get multiple income documents for the household, especially if you got a married couple. Next slide. All right, and then kind of restarting gears. This is the where you'll get to when you're looking for the Maverick application. So you've got an apply online, and you've also got a Maverick application. So same type of criteria. You can apply online, or you can print out the form, fill it out, and then fax it in. So same type of setup as with Gilead. So they're very accommodating as far as the different types of platforms if you want to do either one. Next slide. This is a version of the Maverick application, very similar to the Gilead. It's going to ask all the same questions. This one asks for monthly household income instead of Gilead's asks for annual household income. Everything else is pretty much the same, and it's going to have the patient sign it. This one's going to ask a little more clinical criteria at the bottom, but those are just things to just kind of go through the form, knowing what you're going to need to supply as far as income documents to provide to show they're financially eligible to receive the medication for free from the drug company. Next slide. Okay, so I've talked a lot about, I said income documentation a lot. So the main thing we've already listed is what if they don't have any income, or what if they only get paid in cash? When they don't have income and they don't have, or they get paid in cash only, that's when I will write a letter for the patient. So I'll kind of explain their patient case, that they only get paid in cash, whether they work for themselves or they work for a company and they only get paid cash, or they don't have any income at all, they're staying with a friend. I write all that down in a letter and kind of explaining where they're at and that they're still in need of hepatitis C treatment. So it's important that even if they don't have income documents to provide, they can still get treated, but you just need to write a letter and kind of explain their patient case. I've had great success with the letters. Everybody gets approved. You just got to explain where they're at and where they're coming from and why they don't have any income and where they're at as far as housing. They just want to know those things, and it's worked out well for me. We can kind of go more in depth off in the questions. If you have questions about how to write the letters, we can go more in depth, but that's kind of the main thing. If you don't have income documents, you need to write a letter to kind of show why you don't have any income documents and what's going on with that patient case. Next slide. Now, as far as the letter, we can establish insurance status, establish their income. Do they get food stamps, disability, Social Security, cash only jobs? You can explain those things, and you can explain their living situation. Do they live alone? Do they live with a friend? If they don't have any source of income, they're probably not living alone. They're probably living with somebody, and that's usually how I just want to know where they're at. There's no judgment. I just want to know where they're at. That way, I can explain that to the drug company to make it make sense of this is where they're at, but they're still in need of treatment. So these are the kind of things that I specify in the letter, and then kind of just submit it and see what happens. But based on my experience with the letters, they're really easy to explain all of the extra stuff that you can't explain on the application. There's only just a small amount of space to explain their living situation. They don't have income documents. So I just write letters to be more expansive and detailed about where they're at. Next slide. Now, as far as follow-up, so prior authorizations and patient assistance applications, they're both the same. You want to check on the status in a couple of days if you haven't heard back. Most PAs you'll hear back within 24 hours. Some will actually say 48 to 72 hours. So just if you're past that time frame and you haven't heard anything via Cover My Meds or a fax back, reach out to the insurance provider just to check on the status. There might be an issue or they're still reviewing it. Just want to make sure they received the application. That's kind of the main thing, is knowing that they got the application, because sometimes things get lost in translation, faxes don't get there, or they get misplaced. But making sure that the application is where it's supposed to be and it's being reviewed, that's the most important thing. So if you haven't heard anything back in a couple of days, you can also call the patient when you know that there's a status update. So if you know they've been approved, great, you can give them a call and tell them, hey, we're sending it to this pharmacy, and this is hopefully they'll be reaching out soon. Or if it's approved by patient assistance, that's great. There will still be a week or so before they get the medication, but you can at least tell them status update to keep them engaged, knowing that we're actively working on your patient case. And you can also, that's another touch point after the clinic visit to make sure we've still got a good phone number and we're still able, and they're still with me and they're engaged in the care. And once they get the medication is the main thing. If it's not coming from your pharmacy, if it's coming from somewhere else, we want to make sure that they call you back when they start the medication. That way you can counsel on the medication as well as know their start date. That way when we'll know their projected end date and then their projected SVR 12 date, their sustained viral response 12 weeks after the medication. So lots of things to kind of keep track of. I have kind of a document that I keep track of just to keep all my dates in order, because there are several dates to know along the way. But lots of different components to be aware of with the application process, whether it be through prioritization or patient assistance. And with that, I think that's the last slide. Can I open it up for any questions?
Yes, I think we have some questions in the chat. Also, I just wanted to highlight that the patient assistance programs that were talked about today were really Gilead and AbbVie, because those are what are involved in the simplified treatment as well. But I believe that like Zepatier and some other medications will go through Merck. So for trying to show all the options, I'll go ahead and drop that link in the chat. It's my understanding that it's a pretty similar process in order to get that patient assistance program kind of available. So it's in the chat if anyone's interested. But I do see a question, it looks like from Dr. Talley. So do you have administrative support, Dr. Allen? And if not, any tips to manage the process in a time efficient manner. I think especially, with those letters and things like that, how does that look like in your clinic?
Yeah, so I would say I probably don't have administrative support. I'm pretty much the one person that kind of follows them from start to finish. It probably is not the most efficient for a large scale because I'm trying to think of how many patients I service, but it's manageable for one person to kind of keep it all in a row. So I'm writing those letters while they're in clinic, and I'll have them sign them before they leave, and then kind of if they need income documents to bring back, that's kind of can be a kind of a limiting factor of waiting on that to come back. Sometimes they'll even have them in clinic with me. Some patients will just bring all that they have and they'll actually have income documents to provide. Or if I talk to them, if they're referred from the health department, I can talk to them before they even come to clinic and tell them to bring those documents with them. So every patient's different, and I will just adapt as needed. To that specific patient. If they need to get income documents, I give them avenues of how they can fax it back to me, or they can just make copies and bring it back to the pharmacy, or I can make copies of it for them. They just got to bring it back to me. So just trying to meet them where they're at and be as open as possible on the available options to them. That way, I'm trying to make it easy for them to get those documents to me.
That's really helpful. And I think I've heard, and I see in the chat some others kind of piping in as well. I have heard some other providers say too that they will partner with a specialty pharmacy near them. There's lots of different options for specialty pharmacies, and some of them will take over kind of helping with some of that patient assistance program too. I don't know if Dr. Allen or Dr. Chastain, Dr. Alfaro Cruz, if you all have anything else to add. I imagine it's probably different for each, practice or facility, kind of as to whether or not they do it internally through administration support or from specialty pharmacies. But I look to kind of our subject matter experts to add to that conversation.
So from a pediatric GI standpoint, I agree. We have had very much luck with pediatric or specialty pharmacies. They really have made way easier the process, especially when we're using, Harvoni, Epclusa. So I would definitely agree. I think partnering with us, our specialty pharmacy, it's in the one that we're using right now, it's in Memphis. But knowing and partnering with a local specialty pharmacy or within the region, I think it will make the provider and the nurses that are working on these get the medication easy compared to if you try to do it with non-specialty pharmacies too. I know Walgreens, CVS, they also have specialty pharmacies, and that would be also a way to partnering with them as well.
Dr. Chastain, I thought I saw you come off mute as well, and I think your model's a little bit different if I recall. So
I did. Our models where we work with a internal specialty pharmacy that is based at Vanderbilt, that I work directly with a pharmacist in the collaborative practice within my clinic, where I see patients with a clinical pharmacist in a clinical role that also co-counsels patients, manages patients. I think what's critical about this overall process, Dr. Allen did a great job as far as laying out all the different pieces of the process. It is a process. It appears overwhelming for those people who aren't actually involved in it when we go through it from start to finish. I think on an individual patient basis, it makes both a lot more sense and it's much less daunting when it's actually done on an individual basis. But I also think that once people have the framework for what's involved, this is something that warrants sitting down and thinking about and discussing wherever you practice to figure out what's going to be the most efficient, because very few places does a single provider with no support manage the entirety of the process themselves. People partner with specialty pharmacies, people partner with specific other colleagues within a practice environment or other thing to divide up and conquer the different components. But ultimately, my experience with educating different clinics, programs, or providing technical assistance is that this is very feasible. And often once people have done 1, 2, or 3 of these, it becomes much more routinized and much less daunting. And often it does not take nearly as much time as it appears, but it is something that with technical assistance, the right support and expert guidance, like people like Dr. Allen or the pharmacist I work, Dr. Simonian, it can be a lot of help. And I would say that if there's anyone on the call who specifically feels like they're really interested in pushing or promoting hepatitis C treatment in their program, or they know of a clinic or a program that needs assistance. The Southeast Asia Education Training Center, including myself, can provide technical assistance for that. We can connect people. Know that Dr. Allen, Dr. Flower Cruz, and I am happy to help support individuals as well as the TDH group. And I know that there's several people who've shared in the chat other specialty pharmacies and other resources that have been positive. And so I just encourage you to take action and to ask for help, because there's lots of ways to help navigate this in your practice environment.
And I don't want to make an assumption here make any overcommitments, but I believe, Dr. Chastain, that you all even have some like basically letter templates that can be pretty quickly kind of updated and things like that. Is that accurate?
That is there. We've done lots of technical assistance for individual clinics that can be shared. And so a lot of the tools that Dr. Allen had mentioned, there's a lot of these are publicly available. There's other online resources and other groups that have these available. A lot of it's kind of like the age of the internet. It's not a problem that there's information or resource out there. It's finding them. And actually the personal technical assistance touch can often help people navigate. So again, if you have challenges or issues or barriers to circumvent, you can reach out to Mia. You can directly reach out to our team. You can reach out to our subject matter expert team. We don't want this to be the reason that people can't access viral hepatitis care, whether it be for children, whether it be for people who are pregnant, or for adults.
Absolutely. I think that addressed all of our questions in the chat. Does anybody else have any additional comments or questions? I know it's a lot of information, and like Dr. Chastain mentioned, might be something you kind of sit with for a little bit and then come back and ask questions, and that's totally fine. We're all happy to be here as a resource. While you're thinking of those, yes, this recording will be available to watch later. I can put our link to the YouTube channel in the chat here in just a moment. And we'll get started on our case presentation. But before we do that, one question that actually a provider reached out to me today asking, so it was a provider asking about a private insurance requiring harm reduction services before they would be able to seek hepatitis C treatment. So that was a little bit new to me, because in my realm, we typically don't have a lot of private insurance being involved. So those of you that do, have you heard of that still being a pretty common requirement? Or when TennCare made those changes and the sobriety restrictions and stuff changed, did you see some of that fall off in the kind of private or commercial insurance as well?
I will still see questions about counseling on abstinence from substances, whether it be alcohol and IV drug use, and counseling for adherence. Those will be questions that I'll see. It doesn't ask if they've had a prior history or are they been sober for the past 6 months, but they still ask about, are they going to remain, are they abstinence? Are we counseling on promoting abstinence for substance abuse, alcohol, and IV drug use, things like that. So I do see questions on Cover My Meds, questions from specific insurance plans about that.
Really interesting. Has anybody found it to be a large barrier within kind of commercial insurance? I guess I just hadn't expected to hear that. So I'm just curious to see if it's been a barrier.
At least in the pediatric side, we haven't had that encounter. I think I've only had maybe one patient that actually was private insurance or commercial insurance. Most of our population, it's teen care. So I don't think from in the pediatric world, you're going to have that issue, to be honest.
All right. So in the interest of time, we'll go ahead with our case presentation, I think. So next slide.